Hi, this is Michelle Walker, and today we're going to be doing a postpartum assessment on a woman. Today I have Miss Stabler is my patient, but I have Big Bear who's going to be my patient today. And I'm first going to recite COWIPE, which is you want to check your order and check your patient. You want to assess your patient and assemble all necessary equipment. You want to wash your hands prior to care. You want to identify yourself to the patient and then also identify your patient with two identifiers. You want to provide for privacy. You need to evaluate, explain, and educate your patient. So for today, we're doing a postpartum check on a 4-day postpartum patient. Upon entering the room, I noticed that Miss Stabler was holding her newborn in her arms, rocking and soothing the baby, stroking its face. So right off the bat, you notice attachment to the baby. You notice that she's holding her baby. She was very attentive to the baby's cries and needs. Also, upon talking to her, she smiled while talking about the baby, so that let me know her mood is happy and elated. She appears to have a good support system with her husband who's present and also helping out with the child. And then she is on a regular balanced diet with added fruits and vegetables. She is eating 100% of her meals. She's getting 3 meals a day. So that's good. She reports no nausea, no vomiting, and she is reported resting well. You want to make sure that you check their, if they're resting, how they're sleeping, the amount of sleep that they're getting. Is it restful? She tries to nap when the baby sleeps, so and the support and help of her husband helps her get some rest, and she does report that she's feeling rested when she is actually sleeping. Energy seems well, as expected. 4 days postpartum, she's still a little tired, but being able to respond to her newborn and breastfeed effectively has boosted her energy, and her diet as well. And she is, upon the assessment, you want to do your initial assessment, get your baseline vitals. So your blood pressure, pulse, respirations, O2, and temperature. And you want to listen to the heart and lungs, do your full assessment there. In all the fields, you want to do your abdominal assessment, listen to all 4 quadrants of the abdomen. And then when you first assess them, starting off with their breasts, you're going to be noting any tenderness, any engorgement. You want to know if they are lactating or not lactating. For Miss Stabler, she is lactating. And you want to check the nipples. For her, I put that when I assessed her nipples, they were somewhat flat. So we have her, an interventionist, using a nipple guard, which I noted in the assessment documentation, not a nipple guard, a nipple shield, to help pull out that nipple for latching purposes for the baby to breastfeed. For tenderness, I put in there using some ice packs as needed to help with the tenderness. Documenting any education notes that you put in there, any treatment interventions is important. When assessing the breasts, checking the nipple, checking for engorgement, checking for the tenderness, lactating if they're using a bra, what type of bra it is, whether if they're not going to be breastfeeding, they need to be in a tight fitted bra to help stop with the production of milk. But if they are breastfeeding, they need to have a nursing bra, a supportive nursing bra, which I noted is what Miss Stabler is using. You then want to assess for their their bowels. You want to check if they're having any constipation. For my patient here, when I assessed her, she has no constipation, but she is on just a prophylactic docusate sodium to help ease with her bowel movements. She had just a very, very minor tear, not enough to suture at all, so we definitely don't want any straining down there with the bowel movements. And also you want to note when her last bowel movement was. For Miss Stabler, hers was this morning, and it was a normal soft formed brown stool. And then you want to assess the bladder. You want to assess if there's a Foley catheter in place. For Miss Stabler, she is voiding independently. You want to note when the last time they did void, which when you do a postpartum assessment, you want to first have them void before you start for comfort reasons. But so she voided about 10 minutes ago. You also want to note if there's any bladder distension as well. And then you want to check the uterus, and we'll go ahead and come down here to demonstrate. Okay, so for checking the uterus, you want to check the fundus size. So you're going to be placing your lower hand by anchoring down just above the pubis, and you're going to locate the umbilicus. So when you're finding, just palpating, you want to find the fundus, and then you want to measure. And if she's 4-day postpartum, I know that she needs to be appropriate for that would be 4 finger breadths below the umbilicus. And so you just measure down from the umbilicus, and she is exactly that, 4 finger breadths down below. And then you want to check for firmness, or if the fundus is boggy. Firmness is what you want, but if it's boggy, you go ahead and the intervention for that is to do a fundus massage, and you would just still be anchoring down and then just moving in a circular motion all the way around. You also want to note when you're checking the fundus if it's midline or right to the left. For hers, it is midline, which is normal. And that's for the uterus. Then you want to check the lochia. When you're checking her perineum, you want to check the pad, change it if necessary. You want to note how many pads she's going through in a day. When I checked Miss Stabler, she was moderate lochia serosa, which is the kind of pinkish discharge, which is lochia, which is normal for day 4. And she's going through about 4 to 5 pads a day. And you will also want to note if there's any blood clots present, anything quarter and above, you need to let the healthcare provider know. Miss Stabler did not have any blood clots present, so that's good. And we changed the pad. Then you also want to note if any episiotomy is present when checking the perineum. You want to note any lacerations. For her, I noted that she did have a very, very, very mild tear close to the anus. It wasn't enough to suture. There was just mild redness still, no edema. You want to check your RETA, so redness, edema, ecchymosis, a drainage, and approximation. And she's doing sitz baths. She's using ice packs that were suggested for intervention, and also ice packs, sitz baths, and a peri bottle every time she voids to keep it clean. And then you want to note that you want to assess the legs, and you're looking for any redness, edema, any pain. For her, I noted that there was 2+ edema, bilateral ankles, which day 4 is probably just the excess fluid from pregnancy that she's still trying to get off. There is no redness, there is no pain. So I noted that in the chart as well. So we're just gonna keep an eye on that. And she's ambulating just fine. If there was an affected leg, you do want to check the circumference for it to keep track of that. And then we got the nutrition, we got the sleep, and I think that's everything. We got her emotional status, she's doing well there. Note to any abnormal findings, any depression, detachment, all that, on top of any abnormal physical findings, you want to note to the healthcare provider promptly, and make sure you document, again, any teachings, any interventions that you implemented, and all your findings after your assessment. And that is it. Thank you so much.